Hi, my name is Ebru Gul. My student number is 332844. I want to talk about assertive communication and its importance and health and social care today. Communication is very important part of health and care. Helps health and care professionals, patients, families, and other staff share information, feelings, and consents. Good communication improve patient safely, teamwork, and the quality of care. In this presentation, I will explain what assertive communication is, discuss its strengths and limitations, and show how it can be used in patient care and teamwork. What is assertive communication? Assertive communication is communication style where people express their feeling and needs clearly and respectfully. It is different from passive communication where people do not express and opinions, and aggressive communication where people may ignore the feelings of others. Assertive communication creates a balance between confidence and respect. It allows health and care professionals to speak honestly while still being polite and professional. This style helps build trust, reduce misunderstanding, and improve relationship between health and care workers and patients. Key features of assertive communication. There are several important features of assertive communication. First, it involves clear and direct communication. People express their ideas openly and honestly. Second, it includes good eye contact and positive body language, which helps show confidence and attention. Another important feature is using I. Statements such as "I think" or "I feel". This helps people express their view without blaming others. Assertive communication also involves active listening. This means listening carefully to others and showing respect for their opinions and feelings. Strengths of assertive communication. Assertive communication has many benefits in health and social care. One major advantage is that it improves patient safety. Clear communication reduces the risk mistake and misunderstanding. It also helps build trust between healthcare professionals and patients. When patients feel listening to and respected, they are more likely to share important information about their healthcare. Another benefit is better teamwork. Healthcare professionals can share ideas and discuss concerns and solve problems more effectively. Assertive communication also supports person-centered care because it helps professionals understand and respond to the individual needs of patients. Limitation of assertive communication. Although assertive communication has many strengths, it also has some limitations. In some cultures, direct communication may be seen as rude or disrespectful. because of these people may react negatively even when the speaker has good intentions. Another limitation is that not everyone feels confident enough to communicate assertively. Some people may need training and practice to develop this skill. Assertive communication may also be difficult in emotional situations. For example, when patients or family members are upset, health and care workers may need to focus more on empathy and emotional support. Therefore, professionals must adapt their communication style to each situation. Application in patient care. Assertive communication is very important in patient care. Healthcare professionals need to explain treatments, medication, and procedures clearly so that patients can make informed decisions. For example, a nurse may notice that a patient does not understand their medication instructions. By using assertive communication, the nurse can explain the information clearly and check the patient understanding. Assertive communication is also important when responding to patient concerns or complaints. It's always professional to remain respectful while addressing problems effectively. As a result, patients feel valued, respected, and involved in their care. Application in teamwork. Assertive communication is also important when working with other healthcare professionals. In hospitals and care settings, nurses, doctors, therapists, and other staff must work together closely. Assertive communication helps team members share information clearly and understand their responsibilities. It also makes it easier to give and receive constructive feedback. This can improve professionals' development and patients' outcome. Challenging in real health. In real healthcare settings, using assertive communication can sometimes be difficult. Healthcare environments are often busy and stressful. Staff may have limited time to communicate effectively. Language difference, culture background, and emotional stress can create additional communication barriers. Because of this challenge, healthcare professionals need continuous support and training to improve their communication skills. Improving assertive communication skills. Assertive communication is a skill that can be developed over time. Training programs can help healthcare professionals learn effective communication techniques. Role play and simulation activities are useful because they allow staff to practice communication in realistic situations. Active listening is another important skill that should be developed. Conclusion. To conclude, assertive communication is an important communication style in health and social care. It promotes clear, respectful, and continued communication between healthcare professionals, patients, and teams. It improves patient safety, supports person-centered care, and strengthens teamwork. Overall, assertive communication is is an essential skill that helps health and care professionals prove safe, effective, and high quality care.